Hey everybody, it's Dr. Eric Balcavage, and we're back for another edition of Functional Medicine Monday. And today I want to talk about bone density, and I want to give you 5 tips for helping to improve your bone density. There's a lot of information out there about which supplements you should take to improve your bone density, and I think before you get into taking a lot of supplements to try and improve bone density, most of that isn't super helpful. I want to give you some general tips that you can do on a daily basis that doesn't necessarily require vitamins and supplementation, that you can do to increase your bone density and prevent you from getting on medications that are designed to improve bone density but actually can create quite a bit of side effects. So the number one thing to do is improve your diet. So change your diet from one that's got a lot of processed food in it to a diet that's composed primarily of whole foods. So eat foods as close to their natural state as possible. If you find things in bags and packages and boxes, foods that have been highly processed, those are the foods that typically tend to be the most inflammatory. And at the root of a bone density issue is an inflammatory issue. So anything you can do to reduce your inflammatory load is going to be beneficial. And one of the best things to do is eat more whole food and decrease your intake of processed food. Second thing to do is improve your gut health. So you've got trillions of organisms that are inside your GI tract, and the balance of those organisms really determines how well you absorb the nutrients, whether it's from vitamins or from your food that you put into your body. So cultivating a really healthy gut biome is really important for improving bone density because it helps you absorb nutrients better that can get to your bones. And the GI tract is probably one of the greatest sources of inflammation, and that inflammation could be within the GI tract or it could be creating systemic inflammation. So how do you do that? One, really shoot for trying to get 7 to 8 hours of good quality sleep every night. 2, as we said in the first step, is eat a more whole food rich diet. 3, limit as much as possible the amount of antibiotics that you take. Antibiotics really destroy the gut biome and it'll grow back, but unfortunately many times what grows back is not the bacteria that we really want to see growing in the GI tract. Try and limit things like antacids because antacids reduce the absorption of some of the key nutrients that you need for good bone density, especially things like magnesium. Eat fewer snacks because the more snacking you do, the more likely you are to have dysbiosis in your GI tract, and you're going to get problems with bowel movement, motility. It disrupts blood sugar physiology. So really one of the best things you can do is eat 2 to 3 meals per day and not be constantly snacking through the day. The last is skip traditional probiotics. I just don't think that most traditional probiotics that you buy at the grocery store or at your local pharmacy or at your local supplement store or even from your most doctors are super beneficial at restoring good balance of flora in the GI tract. If you want to take a probiotic, what I recommend is spore-based probiotics. One of the companies we use quite a bit is Mega Spore Biotics, and a spore-based probiotic really seems to do a much better job in stabilizing and restoring normal gut biome. 3, get outside or get physical, I should say. And you can do that outside or inside, but do weight-bearing exercises. When you put weight and do weight-bearing exercises on your muscles, bones, and tissues, that's when bones are going to have to build and grow. And so what happens for a lot of people is we become less active as we get older and our bone density diminishes. A lot of people want to get back into exercises and do non-weight-bearing exercises, but they don't increase the bone density like weight-bearing exercises. So if you're struggling with chronic health issues, yes, ease into those things, but one of the best things you can do if you've got joint issues and if you've got health issues is just get outside, start walking, and start doing some type of strength training to the best of your ability. Number 4, skip the calcium supplements and the vitamin D supplements. Skip all that stuff because what we see is that calcium in a supplemental form doesn't do a great job of getting to bone. Many people are flooding their body with high dose vitamin D, which can actually be more problematic in bone density. So skip the supplements unless somebody's actually done an appropriate evaluation of your blood chemistry and really determined that you need supplements like calcium and vitamin D. skip those things and just eat foods that are rich in minerals beyond calcium that can help with bone density. And the best thing to do is eat those green leafy vegetables. Number 5, get outside. 15 minutes of sun exposure every day is going to be beneficial in improving your vitamin D levels. Much better for most people than just pounding away on supplements, okay? Get outside. It's great for your emotional state, helps reduce stress. It helps you get more vitamin D conversion. And if you're outside, you're probably going to be more active, and that's going to help bone density from that perspective. So those are the 5 things that you can do on a daily basis to improve your bone density. Have any questions? Always reach out to us at the office or put your comments below wherever you watch this video. Take care.